Hi, I'm Cathy, and I am a certified wound care nurse, and I am so excited to tell you about my latest deck, which is Wound Care for Nurses. So chances are in nursing school, you learned how to do a sterile wet to dry dressing change. And in nursing school, you definitely have to get that skill set down and pass your skills exam. But I'm here to tell you that once you graduate and come to an acute care setting, chances are you will never use that technique again. That is because we really use different products and different procedures to take care of our patients' wounds at the hospital. And that's really why I built this deck. This is a real world guide for how to care for your patients' wounds. And I've provided a lot of information that I hope will be very helpful for you so that you can be comfortable and confident in wound care, which is something you'll have to do all the time when you are in an acute care setting. So some of the things I've included in this deck are instructions on how to perform a comprehensive skin assessment on your patient, how to identify patients who are at risk for skin breakdown, and how to prevent them from having that skin breakdown. I go through the pressure injury staging and how to care for pressure injuries, and there are illustrations for each of the stages, like this card. In addition, I talk about how to properly assess a wound, how to measure the wound, including how to identify tunneling and undermining in the wound. I talk about how to clean the wound, how to get a culture of the wound correctly, as well as how to properly remove staples and sutures. In addition, I go over dressing. So chances are if you've come to a hospital and gone into the supply room, it can be pretty overwhelming with all different types of dressings for wounds. So I really break that down and talk about each type of dressing and what type of wound it's appropriate for. In addition, in this deck, I talk about arterial insufficiency wounds as well as venous stasis wounds and neuropathic wounds such as diabetic foot ulcers. And then I also talk about how to care for your patients who have a wound vac in place. So I do wound vac dressing changes all the time at the hospital, and I have some detailed instructions and then some graphics here on how to do a basic wound vac dressing change. And then finally, I cover how to take care of your patient's ostomy and how to do an ostomy appliance change. So hopefully all this information will help you feel comfortable and confident in performing wound care, and I hope you love the deck.